Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi.
Good afternoon.
And today's topic is a very interesting topic, Dr. Anju. As you know, that we all have elderly in our homes. So we are going to discuss about the geriatric type of...
yes, because last few times we discussed about the for the children and the newly born, toddlers, moms. So we thought about discussing we are having these type of topics how to take care of the elder population.
Right, and it's a very good topic because we come from the background where we take care of our elders at home, and now majority of us, those who are called NRI, non-resident Indians, that means we are living in the foreign countries across the globe, and our families have moved in, our parents have moved in. So, there are a lot of scenarios and criteria changes as we have changed the location so far. So I think we really need to address this issue with our people and all those listeners who are listening the radio today. Please feel free to call us at the phone number 1-844-301-1250 1-844-301-1250. आप हमारे साथ हिंदी में भी बात कर सकते हैं, उर्दू और पंजाबी में भी बात कर सकते हैं. फ़ोन करने के लिए आप हमें 1-844-301-1250 पर फ़ोन कर सकते हैं. मैं एक बार दोबारा ये नंबर रिपीट कर देता हूँ, 1-844-301-1250 पे. और आज का जो टॉपिक है वो है एल्डरली पॉपुलेशन. जो हमारे फैमिली के बड़े बुजुर्ग हैं, उनका ध्यान कैसे रखना है, उनकी सेहत का कैसे मैनेज करना है. क्योंकि जैसे जैसे एज हो जाती है, बड़े बुजुर्ग हो जाते हैं, तो उनको सर्टन टाइप्स ऑफ जो है क्रॉनिक डिजीज़ का बना रहता है, आशय बना रहता है. तो उसके ध्यान रखने के लिए हमने ये शो आज किया है. तो आप हम फील फ्री टू कॉल अस एनी टाइम एट 1-844-301-1250. And it's a very common thing in our culture that we have elders.
Yeah, we have the elders back home too. In the back home, as we know, with the Indian background, we take care of our elders at home mostly. But over here in the US, there is they have the old people home or the nursing homes, where people usually goes there and get treated, or they stay there. But same time, like we are our like the family and friends and ourselves, like we do have the elders at home, and sometimes they are moving back with the children over here too. And I have noticed like they feel kind of lonely here. They have the limited sources, so we need to look into that direction, like how to help them, how to make them busy at home, and also how to take care of their health. Like many times we will underdiagnose like the nutrition wise, like if they are eating properly or not.
And sometimes, Dr. Anju, I noticed that as the elders, the age, their appetite is also not the same, and they may not be, and their digestion is not the same.
That is very much true. And if I see like the same thing, like if I give my example, like my mom and dad, their tastes are not the same as it was when I was growing up. So we really need to pay attention. Like food we are cooking, like if our elders are refusing to eat, or if they are saying like it's too spicy, or it's not like it's their taste buds changes with the time too.
Right, and that's usually an indication that there is a nutritional deficiencies
Yes.
are going on. The mineral deficiencies are going on because they are not absorbing those minerals in the gut. So that's the very first sign. That's the very first sign that they might have vitamin deficiencies along with the mineral deficiencies.
Yes, along with the mineral deficiency. And if we don't remind our elders, especially after 70s, or that they have to take these all the multivitamins and minerals along with the proper nutrition. We will talk about that a little bit later. It's important. Like so, and the same time the malabsorption too.
Right.
So maybe their gut is not that's not the same. So we need to look into that direction too, that if they are absorbing well or not, even if they are taking and still. And so we will talk about that in more.
And also the most common diseases which actually can affect, or the conditions which affect the older population more. We will discuss that as well. तो आप हमें फ़ोन करने के लिए 1-844-301-1250 पर कॉल कर सकते हैं. मैं नंबर दोबारा बोल रहा हूँ 1-844-301-1250 1-844-301-1250 and you are listening to Your Body's Natural Pharmacy, and I'm your host Dr. Shailinder Sodhi along with Dr. Anju Sodhi. So the things which this is not only the problem within our own culture, but I mean this is a mega problem for American population too. So what I see is that right now in one survey, in one statistics, that our older population is growing because
Yes.
people are living longer. So that means the bigger the population is, that we need to understand that there will be health issues in that population as well, because we are taking care of our elders. The population which is growing at the number, like currently I think in one status showing that we have over 38 million people, and by 2060 it is going to grow to about 92 million people.
That's
in the
a
US.
big jump.
It's a big jump. And I also look around within our own community. I'm talking about Southeast Asian population, Indo-Pakistani populations, and Fijian populations. The Indians in the greater Seattle area, we are close to now 70,000 people who are in greater Seattle area. And I also, because I have been here for a long time, and when I look into the time when I came and the people I have seen at that time, there is a much greater population which is above 70, and some of them are even 80s now. Though within our own community, we have these, Indian community centers, they organized with the IAWW where they are.
It's a wonderful that I'm glad you talked about that. The IAWW has they do for the seniors. I believe it's in the Redmond.
Townsend Center, yeah.
Redmond, they have, and they every Tuesday they have for the elderly people. I think at around 4 o'clock. But you can go and check on the IAWW website. and they really do really well. There is a
They do
different.
really good job.
They
I have
do
been
very
couple
good
of
job.
them,
They do different topics. Somebody will be speaking,
and then
and
also they use exercises and
nutrition and the
and
games, and so it's very
the
important.
social.
Yes, it's very important that they are not like they don't feel lonely, they don't feel bored, they don't feel neglected. That is the main thing.
Right. The one thing which I have heard from the older population, with those who have come to our clinic, especially with the Indian patients who have shown at our clinic in Bellevue, at Ayurvedic clinic, these elderly people will say that they do feel lonely on the weekdays when the kids are gone to work out, exercise, and nobody's at home. And because they are limited, because they cannot drive or they don't have transportation, so sometimes that leads to a depression, which is a really very bigger issues with the older population. And the only time they feel happy is they say when they know the kids will be back home, or on the weekends or the holidays, when there is some children's around, that the grandparents get happy with that. So especially the way our culture is, we like to keep our parents, grandparents around, and making sure we take care of them. And that's a structure which have worked really well for our society, where these grandparents are spending a lot more time with the children and the grandchildren, and the bonding between the grandchildren and grandparents is really great, because our children learn from their grandparents, from the experiences and the stories, which is a really great way of giving them a company.
That is very much true, and that is if I have noticed, like the people, they don't have the influence of the grandparents on the children. They usually do not learn lot of things, even the language. They don't speak the own language, so which is really sad. So if the grandparents are home, it's really they have to speak with them in their own language, so they learn that way. And that it's a big help with the elderly at home too, so they can take care of instead of the leaving the young children at the babysitter or daycare. And it's, if they are home, they can take care of the children. So it's a give and take, guys. So Dr. Shailinder, you want to talk a little bit about like the what issues you want to address? Like I have noticed like the patients we get, like the inflammation is the main, arthritis is the
that's a very common one thing which they notice. And that arthritis is going to hit. The reality is that if our population which is growing, I mean within grandparents, they will definitely have some joint where they're going to have degenerative changes, and inflammatory processes are going to cause debility, and sometimes maybe very severe arthritis, where these guys are not even able to walk, and to the point where we may have to take a very drastic approach from the knee replacements to the hip replacement. So before we get there, I think there are certain things which can be done.
Yes, so we want to tell that how to take care. So everybody, I believe, like at the age 65, if they are not taking any, they have to start earlier. That's better. But like as we grow, our hormone decreases too, and that leads to the many factors. So we need to start taking care of that by taking the multivitamins and minerals, and then the nutrition, like the proper eating habits. I have noticed in the patients we see at the office, like they are not eating the enough proteins and enough green vegetables, enough fruits, and they are not drinking enough water as well. So all those things we need to pay attention.
Right. It's also sometimes I find these are the issues because out of the boredom, because they are alone.
Yes.
They do not feel like having something. So, folks, it's so important that we need to keep that type of environment where our elders do not feel that way. That means there is always some sort of a company for them.
And then, like we were talking about the arthritis. So many times, by when we see the patients at the office, by addressing the diet, they feel so much better.
Right. So in simpler, like in arthritis, I think sometimes we forget that there are common household spices which can be used in the food, and they have as good effect as any over-the-counter painkillers. And one of the most common spices
Is
turmeric.
the turmeric and the ginger. Ginger
Right.
people do use, but sometimes you need to. They don't understand that they need to use it more. So by using ginger powder, 1 teaspoon, 2-3 times a day, mixed into the water. One thing, it's analgesics too. It's anti-inflammatory too, and plus it's a good for the digestion. It will improve their digestion, their gut. So that is very important. The curcumin, the turmeric, Indian population do use a lot of turmeric, but if we are taking for some reason for the pain or the pain in the joints or anti-inflammatory, then you need to increase it. You need to take it more standardized extracts, or even if you take the turmeric powder, take it organic and take it more. It's like if you are just putting into the food, maybe you are not putting enough, so you may have to 1 teaspoon 3-4 times a day.
The other thing which with the turmeric is that you can not only have to add to the food, but there is a way to add to the smoothies, which is really
Yes.
good for the elderly populations. Some of the way they can get a nutrition is through the getting the wholesome foods and smoothies and soups, and these are the best way to address their dietary needs.
That is very much true. And for the smoothie too, they need to use lot of nuts and seeds. They can soak the nuts and seeds. So by soaking any food, it becomes more digestible. So by soaking the nuts and seeds, and by putting some, sometimes the adult they don't want to, the older people, they don't want to eat a lot of vegetables and fruits. So then by throwing that everything into the smoothie with some nuts and seeds, and you can throw some turmeric in it too. So that makes a good combination, and it's delicious, and they'll be able to digest it and absorb it better too.
Right. Folks, if you have a question regarding around your grandparents or parents, or if back home, somebody's, if your parents or anybody in your elderly population having issues, feel free to call us at 1-844-301-1250, and you're listening to the show, Your Body's Your Natural Pharmacy, and we'll be right back after the short break.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022.
Good afternoon, folks. We are back from the short break, and we are discussing about the elderly health care in our homes, as well as what are the most common diseases which happen in the elderly population. So, one of the most common things which do affect, other than the arthritis, is diabetes.
Diabetes.
Type 2 diabetes is fairly common in the elderly population. And, the one thing is, wherever there is, if we know our great-grandparents or there is a family history of diabetes type 2, there's a chances that our parents will probably are prone to have this. So one of these things is that, there are preventive checkups, regular preventive checkups, which really test for that and can indicate that there is a, probably either sugar intolerance, or we usually, before we call it pre-diabetic type of things and diabetic, we start pointing that out, that there is a weakness in the sugar absorption in the system. That means these guys are not able to handle the load of sugar. So, and we also know our population from India is a much bigger, is a vegetarian population.
And they eat a lot of carbohydrates.
And
they love to eat carbohydrates.
And that is something which we need to address within our own population as well as with our elder. So, the diet here, Dr. Anju, is one of the things which plays a major role.
Which plays major role. And as Dr. Shailinder said, that the vegetarian population. So vegetarians, it's nothing bad to be vegetarian, but the vegetarian people ends up eating more carbohydrates if if they are lacking and the awareness is less. So they need to make sure that they are eating some proteins. And I have with my folks at the office, patients, they complained about the eating the beans, like they feel very gaseous, or like as they say that they are getting elder, they cannot digest it properly.
Right, and to my, I usually tell them the best way to handle the beans are, if you're a vegetarian. So if you're going to have beans, then you need to make sure you soak them.
Soaking is very important, especially the whole beans. All the kala chana is very good for the diabetic patients. Like it has the low glycemic index, but again, you have to cook thoroughly, but soaking 12 hours is very important.
And usually what one of the trade of the trick is that when you soak, having a little bit acidic medium, that means adding a little bit lemon or vinegar in the water actually helps to break down the phytates, and those are the reason what causes the issues in digestion, that they feel bloated, because as our digestion gets weaker, we have lesser hydrochloric acid in the stomach to break down these proteins. So that actually when we soak them, those phytates are easy to digest, and when we boil, and actually cooking for longer cooking hours also helps.
Longer cooking hours too is, but like then putting some goods like the spices, which helps with the digestion, as well as they have the anti-inflammatory effect. Like the curcumin is great, and most of the Indian population do use curcumin a lot when cooking the beans too. But then there is asafoetida. Some people use, some people don't, but that has very good effect too, especially with the whole beans. It helps with the digestion too.
And I'm sure the majority of our Indian population knows asafoetida. It's also called hing, and being a sulfur compound, it's actually very beneficial for the lots of digestive issues, as well as being a sulfur compound. It's good for the joints and all that too. So I definitely recommend using right amount. I think Dr. Anju, you probably can tell.
Yeah, you don't use a lot, because then it has a strong smell, as it's a sulfur compound. But by using some, I just mix it into the water and dissolve it, and then put it into my beans, especially the whole beans. And then the ginger, I use a lot of ginger, and then I suggest to use a lot of garlic too if people eat garlic. Some people do not eat garlic, then they can rely on the ginger and the asafoetida, and then there is other spices too, like cumin seeds and the coriander.
For the diabetic population.
Cinnamon is great for the diabetic. So like purpose is like to eat the beans. If you are vegetarian, beans is a good source of protein and complex carbohydrates. So that is great. And then the other grains, which a lot of people are not aware, or they don't eat, like Indian population especially, they eat a lot of wheat. But there is another, like there is good, like the amaranth.
That's a very common, right? In our food, wheat dominate quite a bit. Actually, maybe it's a worldwide, but I think especially in Indian population, and the North Indian population, definitely love to use the wheat quite a bit.
But now that, like when we were growing up, the wheat flour was different. Now it just seems like it's a...
it's modified.
It's modified. Then the GMO is the another issue too. It doesn't have the fiber,
and there's more, I think the gluten is becoming a bigger issue. So folks, when we are treating a diabetic in our elderly population, the wheat is like we're saying can be an issue. So the choices are like
Then choices are there is amaranth flour available, which is great. There is
millet.
Millet is great. Quinoa is great. Even the jowar flour. So I suggest my patients to eat less grain, but they can eat at least once a day. And then rice, if they are eating the rice should be, they should be eating more brown rice rather than the people love to eat white rice.
Yeah.
But brown rice would be so much better for the.
And I think it's like getting used to the taste is an issue. But otherwise, quinoa cooks like a rice.
Quinoa is great too. Some people, most of the people they like quinoa, but some people I do get like that do not like quinoa either.
It's a taste issue,
It's
right?
a taste
it's a tongue
issue.
issue. But I think,
and then I suggest my patients to mix the rice and quinoa or the brown rice and quinoa, and then they are able to like it. Slowly they start liking the other grains.
Otherwise, I think for the elderly population who are diabetic, I think one portion of rice or quinoa or amaranth or millet with the 2 portion of beans. This recipe is for the vegetarian folks. Is a good exchange where we can have more protein in the diet and will also affect as a low glycemic type of diet. The rice, remember, do have a high glycemic, so the blood sugar will go up with white rice, but the brown rice will less. Quinoa will be even less. Millet and quinoas are my favorite, and amaranth are my favorite. If you can get
and
used
amaranth
to.
has a lot of protein and amino acids too for the like the vegetarian people. And then for the people who eats the non-vegetarian, then the fish is the great choice for them. But eat wild. Do not eat the canned fish or the tuna.
Especially the tuna. Even
Yeah.
if you're going to have canned, then I recommend the salmon. The Alaskan salmon is a better choice. Or the patties, which we find very commonly available in the bigger store chains. You can buy the wild salmon patties, and that is a great source of good protein with good fat, and it's a very healthy food.
Yes, wild. Buy wild. Don't buy the farm-raised fish.
And the reason we tell not to buy wild farm-raised fish is basically there is a usage of certain colorants they feed to the fishes to make their skin looks or the fillet looks just like how the wild salmon will
and
look
the heavy
like.
metal toxicity.
And because of the feed,
common.
and also they feed antibiotics and other things to keep them make disease free. But anyway, the best choice is a wild fish.
And then the chicken should be organic too. They can eat the chicken too, and because this is good, the diabetic people need to eat more proteins.
Right, and the proteins, and we need to make sure the protein and carbohydrates are kind of balanced out. So also having a good walk is very important.
Walking is very important.
And the walking a little bit, I will say, grandparents need to move out of the home. I mean, if there's a cold weather, dress up warmly, nicely, and walk. So I think we have a caller on the phone, and we will take the call and come back and address this issue a little bit more. Caller, go ahead. This is Dr. Shailinder Sodhi on your show, The Body is Your Natural Pharmacy.
Hi, good afternoon, Dr. Shailinder. I am Sagar, and my question is that my grandmother cannot walk properly because of a problem of knees. So can you suggest any exercise that she can do for relief?
That's a very good question, Sagar. And like I think our show started with that elderly population having inflammatory issues. So the reason she is not able to walk is most probably we call degenerative arthritis in the knees. Then that's very painful, and sometimes you wear out the complete cartilage, and these type of patients sometimes we have to be very careful if the weight is an issue. Or also, what level of damage is to the joint. So anyway, your question is what type of exercise should be recommended. So I think one of the exercise which I recommend, Sagar, to the elderly population, we call them building the quads in the legs. Quad muscles are the upper thigh muscle above the knee muscles. These muscles need to be strengthened. So there are elderly population which they can do exercises. Some of the exercise they can do is as well like the chair exercise, in doing lightweight and light lunges. That mean where they can just do stand up and do very slowly, go down and stand up. That will strengthen the legs. And any type of exercise which will bring the strength to the hip muscles and as well as the gluteal muscle, the buttock muscles, will help. And also strengthening the calf muscles will help to stabilize the joint too. So the leg exercises are the most common exercises. But like I said, how old is your mom, grandmom, Sagar?
So she's 65.
Right.
Or
so,
70.
Yeah. Oh, okay. So she's 70. So the thing is that at the 70-year age, if you probably will know that if your grandma never worked out exercise, then it is a way to start very slow process. That means I tell start slowly. Maybe start with 5 to 10 minutes of exercise every day.
Yes.
Twice a day. Like spend 5 minutes in 10 minutes in the morning, and 5 to 10 minutes in the evening, and slowly build up to the maybe 15 minutes, 20 minutes exercises. And the other thing is yoga. I'm a big fan of yoga.
Yoga is very good, and if she has the access, or if she can go somewhere to start doing yoga, or someone can come to at home to help her with the yoga, she will be much better. She will be much better.
Now, I find it, the people who have, the knee issues, yoga really helps to mobilize the joint. And, there are lots of yogic exercises which can be done for the knees and hips, and that really will be helpful. So again, Sagar, the emphasis is going to be strengthening the calf muscles, which are below the knee, and then the thigh muscles, which are above the knee muscles, and the hip muscles, and the gluteal muscle or the buttock muscles need to be strengthened. So there are certain exercises. You can also look into there is one way to look into these days is electronic media, I call it, the Google or into the internet. You can do certain small exercises and maybe send those to your mom, grandma, and she can do it. So this will be good.
And then most common, like people can do like a sandbag on the ankle, and then just raise the leg with that by sitting. So that will help her
That's
too.
Again, start with very lightweight. Very lightweight. Doesn't have to be even bigger weight. I think I will couple pounds, 1 to 2 pounds even start, and to the tolerance. And doing those exercises will definitely strengthen the thighs muscle and will improve the arthritis in the knee, which means she will have lesser pain. Once she will have a lesser pain, then I do recommend to make sure that she walks every day. Take maybe a walk around the block, or 5 to 10 minutes, or go slowly build it to longer. So these are all exercises which are good for the joint, also good for when they go out, they feel good about it, the fresh air and all that. So their cardiovascular exercises, they're included in it. So Sagar, these are the recommendation, and making sure that she does eat healthy nutritional diet.
Nutrition and some supplements in that elderly population is very important too, by taking the calcium, and magnesium is a muscle relaxant too, which really helps too.
Right. So Sagar, thank you for calling. I hope these small recommendation helps. And to folks, in order to call us, please feel free to call at 1-844 301-1250. Again, the number is 1-844 301-1250. आप हमारे साथ हिंदी, उर्दू और पंजाबी में भी बात कर सकते हैं. कॉल करने के लिए आप 844 301 1250 पर कॉल करें. So we will be right back after the short break, folks. We are discussing about elderly health populations issues.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Welcome back, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi, and today with the topic which we are discussing is the health issues in our elderly population within our own community. And so far we have discussed about the inflammatory issues, and we also talked about the diabetes in the elderly population. And the other, which is a big time issue, is a heart disease in elderly population. According to the CDC, heart disease remains the leading killer of adult over age 65. It's still the leading cause of death above the adults above 65. And what I'm finding that in our Indian population, it is a bigger issue. I know more people who have had heart attack or have gone through either bypass or stenting of their heart because it's just the way we are living our life these days. And so, one of the things which in elderly population, it becomes very important that, once you have crossed 60, they need to have their annual routines done. I mean, I think one of the things which I find in our culture, especially in East Indian population, the elderly do shy away for getting their annual physical. Don't you see that number?
That is true. That is true.
I mean, even if we look at, about your parents, I know your dad is very good, but your mom on the other side is totally opposite.
Yeah, my dad has to force her to get her blood test done.
Right. So I'm glad, there is that type of where your dad is able to enable her to make sure that she does it. But that is an issue with a lot of people in our population.
Yeah, and if the husband wife both parents are not into that, then the children, it's our job to make sure that they are having their checkups routinely.
Yeah, one of the things we need to remember that as our elder age, they are increasingly living with the risk factors such as a high blood pressure and having high cholesterol.
Yes.
These are the two factors which really contributes to the heart disease.
Yeah.
So, if there is an issue of high blood pressure at the younger age, as a kid, if you saw your dad or your mom have had a blood pressure issue, and then you top it with the cholesterol issues, it's a flag. It's a definitely red flag that once they crosses 60, even in our population, I will say people should start getting concerned after mid-50s.
That is very much true. And if they know that their cholesterol is staying on the high side, especially the bad cholesterol, and their good cholesterol, which is the HDL, and those are staying in the low side, and they're still not taking, and on the plus they have the high blood pressure or those type of issue too. So and they are not paying attention, so that is worrisome for the for a stroke or heart disease or some sort of. So for those people, it's very important to take care if they are not on the medication. If they are, there is ways to avoid that. There is ways to bring your cholesterol down. There is ways to bring your glucose down. So all these leads to the heart disease.
Right. So again, folks, when we're discussing about the heart disease and stroke, high blood pressure and cholesterol issues, exercising is very important. We need to add component of exercise. Like I said, I don't expect, if you never done exercise in your life, then start very slowly. There is no reason to start full blown, okay, today is my day and I'm going to go for 1 hour of a hike, or that's also very tough hike. That's not the way to do exercise.
That is not the way. If the blood pressure is staying high, people are more aware now. It's not like they are not, but if the blood pressure is staying high, start with the walking. Start walking every day.
Yeah, and make a routine that, even if it's a cold weather, make sure you bundle up. I mean, wrap up yourself, because even a cold weather can lead to a heart attack.
Yes.
And that's very common when people are shoveling the snow or ice in the they get a heart attack because the blood vessels go they squeeze down and the blood supply stops to the heart, and here you go, you got a massive heart attack, and now you have a person who is probably need very urgent and very early reply or response to their health issue. So anyway, so start exercising, eat well. And I think we started telling that, in elderly population, their digestions are weak, so they need to eat, healthy food, and paying attention to cut down the sugary diet.
But cut down the sugar diet, cut down the fats are not bad, but they need to know what kind of fats they can eat. Fish oil is great. They should take the fish oil. That
olive
will help.
Oil has another good.
Olive oil is another great oil too, and that will help to increase the HDL, and that is cardioprotective.
And both oils, the fish oil and olive oil are good.
And then the flaxseed oil. Flaxseed oil is great for the men and women both. That has the anti-inflammatory effect. It's omega-6, and then it's people can do the flaxseed meal too. The ground flax seeds are
right. I think that's last, I think one of our show I told you, okay, Dr. Anju, the flaxseed laddus are my favorite. The ulsi laddus. Ulsi is
and that's a good nutrition for the elderly people. And back home, like we used to make, and it's a winter food. It's for the cold weather. It helps with the. It's just really a good food, and you can make it really nutritious. You don't have to only make it with the wheat flour. You can use the chickpea flour, and then you can use you can mix the flours, and then
a mixed bean flours.
Yes, and then the ghee is not bad. Ghee is not bad, but you have to be a little bit careful. If your cholesterols are very high, then it may not be.
Even there are studies which have indicated that it does have a cardioprotective. Yeah. But the thing is, amount of caloric intake which goes versus amount of activity you have.
Activity that is very important.
So anytime you can eat a lot of good food, good things, and if your activity level is less, then you kind of just burdening your system. That means you will gain a weight, you will become obese because you're not making muscles. Actually, you're gaining weight. The body has to use whatever food we put in.
That is very much true. Sometimes I get patients and they say that they have started eating well. They are eating more ghee too, and they are eating more nuts and seeds too. But then same time, you have to exercise as well to lose the weight. If your calorie intake, the oils has more calories, then you need to make sure that you are eating other calories are not high. Also, you have to make
all those high caloric food need to be lesser. So anyway, eat well and make sure you get a good sleep. And that's also an issue with the elderly population, that they become insomniac. Yes. And that's also sometimes a lack of exercise, and sometimes other issues, and sometimes it's a hormonal issue, and sometimes it's a thyroid issue. And as we age, our thyroid do slow down.
Yes.
And so there are certain diet which can actually keep your thyroid in upbeat. That means thyroid can regulate your metabolism. And thyroid is a gland, one of the glands which is very important for population.
From the childhood
to all the way up to age population. So if you have a sluggish thyroid or hypothyroid, you are the one individual who is going to have a tough time to lose the weight. In fact, you will add more weight if you do not have activity level going up. And it also increases the risk for cholesterol issues and cardiovascular issues. So, folks, again, by telling you all these things, I'm trying to get your attention that getting regular checkups are very important. It's getting annual physical. So, get yourself, when you get a complete metabolic profiles, these are some of the tests which are done. We test for your blood sugars, cholesterol get checked, kidney functions get tested, liver function
and
test,
especially with the elderly patients, like for the men, especially the prostate and the kidney functions, and all those are very important too. And the cholesterol, if they have the issue with the heart disease or the diabetes, hemoglobin A1C, and the glucose. So all those with your annual checkups, people can get that.
And we can detect all these things, and which can be a risk factor for the cardiovascular or diabetic issues. So anyway, eating healthy, sleeping well, having an exercise regimen in a daily routine is very important. So folks, feel free to call us at 1-844-301-1250, 1-844-301-1250, And you're listening to the show, Your Body is Your Natural Pharmacy, and we'll take a short break and we'll be right back.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Hello, folks. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy, and today's topic, which we are discussing, is the health issues in the elderly population within our own society. So, we have discussed so far the heart disease is still the leading cause of death. The second most leading cause of the death among elderly is a cancer at 65 age and other upper group. So, in 2014, according to CDC, over 400,000 people died because of the cancer.
Wow.
So, that's a big number. So, the CDC also reports that 28% of men and 21% of the women over age 65 are living with cancer. So, 28% men and 21% women over 65 do live with the cancer. So, if caught early, there are treatments available. And, I do recommend in the elderly population, they should be doing their preventives like mammograms, colonoscopic exams, skin checks, they should see the physician. If there is if you have either lost weight drastically or gained weight, these are indications there is something seriously going on.
Yes.
And sometimes of these elderly population thinks that they're probably not eating, and that may be the reason.
Yeah, that is, it's underdiagnosed with the elderly patients. Sometimes we think like, okay, it's just a age-related weight loss, and it gets underdiagnosed, and then like when we find out about it, it's maybe too late.
Yeah, so early detection is always a good, it has a good results with the early detection. If you keep on ignoring it, and the chances are that it can spread and metastasize, and things can go downwards very fast once you are having a progressive or the very fast spreading cancer. So cancer is in itself is a scary word, but if you get diagnosed, it has a very good outcome. And the other issues the one thing is the respiratory issues over in adult population above age 65. Especially the chronic obstructive pulmonary disease are common. So I do see the lung functions do decrease. So people who are doing pranayam, breathing exercise, they never hurt. And the people who are smokers,
Yes.
or exposed to some sort of chemicals, asbestos in their life, these people need to be very careful.
They need to be very careful, and they need to see the doctor, and they need to do whatever they can do, and to get help.
Right. And a lot of elderly population, men and women, they live with asthma and also bronchitis, emphysema, especially smokers. That's an issue with the lung. I mean, if you're a chronic smoker, trust me, you probably have some level of emphysema if you have not quit smoking in early age. So, getting again checked, that's good. And I know, Dr. Anju, you wanted to discuss about Alzheimer and dementia. That's another major big issues in the elderly population. And, in one study about, in our U.S. population, over 92,000 people die annually from Alzheimer. That's the study within the U.S. population. But in our Southeast population, in Indian population, the numbers are very different, very low. We do not have Alzheimer as pronounced, as bigger as in the Western population. And
I think the curcumin is like people eat a lot of curcumin.
Yeah, and the folks, those who don't understand curcumin, it is a part of turmeric, the yellow coloring in the present. So that protects the brain. So I think maybe that is the key. We do not have a bigger population of Alzheimer in Southeast or Indian population, but we do have dementia.
Yes.
And that is usually, again, dementia can be related to with the vascular issues in the brain, circulatory issue. That mean the blood vessels, if they have atherosclerosis, that means narrowing of arteries or hardening of the arteries with the plaque and the cholesterol buildup, that can lead to the damage to the neurocell, the nerve cells, and that can lead to dementia. And in our population, we usually sometimes jokingly, or sometimes if somebody sees some elderly mixing up things, we say, 70-72. Yeah, that means, this guy is have some sort of issue with the brain. That 70-72 means you are over 70, and we expect this type of things are coming up. So anyway, that's a serious issue. It's a joke aside.
It's a very serious issue, and maybe the few things they can do is like that with the dementia too, with the proper diet, and by taking some good oils like omega-3 oils.
Fish oil and flax oils are my favorite.
The Brahmi is the Ayurvedic herb which they can also take, which really helps with the with dementia too. And then there is a nutrition. Nutrition is very important.
Nutrition and exercise and keeping brain active is a very important in elderly population. Keep them in elderly, they need to keep their brain busy and active, doing some sort of cross puzzles or reading newspaper every day and reciting stories to the children. That actually keeps the brain active. More brain activity you do, better your brain function is in the elderly population. And then I think I also want to discuss the osteoporosis is common in elderly population, especially in Southeast population, the vegetarian populations, where they kind of lack vitamin D sometimes, not taking calcium and minerals. And the women are more prone in our population because they also lack of exercise. So with all these things, I think we need to really take care of in elderly population. As we come to an end of the show, Dr. Anju, I think the take away from the show is that making sure that we're paying attention to the nutrition in the elderly population. If the digestion is poor, we need to make the food which is easily digestible. And khichiris and soups
and by taking like the triphala, I think everybody, people, they do know about the triphala, and it's a great herb, combination of the three herbs it helps with the digestion, absorption and elimination. That can be given to the elderly too, so their digestion can be improved. And the probiotics is the other thing which I will...
And those fermented foods are another way to keep the probiotics in the body. And also making sure that exercise is important.
Exercise is very important.
They need to walk. If there is a diabetes or known to be sensitivity, or if you know that your parents had a diabetes, that means great grandparents or something, family history of diabetes, then start watching, because you do have that tendency to develop diabetes even within you. Not only your parents or grandparents, but you yourself need to watch. That means develop a habit, eat healthy, exercise routinely, and seek consult. And at our clinic, at Ayurvedic Naturopathic Medical Clinic in Bellevue, we do that all the time. When you come to us, we kind of take complete history. We understand your reasons and causes, what's causing those issues. And sometimes we do the blood work. Actually, majority of time we will do blood work, and we will make a plan according to your issues and guide you accordingly. So to come to our clinic, our phone number for the clinic is 425-453-8022. Again, the number for the clinic at Ayurvedic Naturopathic Medical Clinic in Bellevue is 425-453-8022. And we have a combined experience of over 40 years of experience.
Yes.
I've been in practice over 22 plus years, and Dr. Vinder been in practice 30 plus years, and Dr. Anju, you've been in practice for 22 plus years as well. So, we kind of give you the whole.
Yeah, we do all the preventive exams too, all the women exams too, and a lot of nutrition and exercise, pranayam. So we talk about almost everything, and we
even do panchkarma at our clinic. So anyway, the 5-step detox Ayurvedic treatment, which is rejuvenative. So anyway, at the end of the show, thank you for listening to us, and we'll be back next week.